Today, I want to talk about kidney performance and the protection that cannabidiol can offer people with kidney disease of all kinds. It has some extraordinary benefits, and I've got a lot of important things to tell you about. Our agenda today is going to include the disease spectrum, different types of problems that we see with kidney disease, the burden of disease on the nation and on the world, the endocannabinoid deficient that is so common in many of these conditions, and particularly with kidney disease. Evidence for cannabidiol benefits, how it can work in kidney disease to make a real difference in patients' lives, as well as protecting the kidney and preventing problems. I'll talk about some of the serving sizes and how you can manage kidney disease with CBD. And I'll go over some of the references and answer any questions that you have. I also have a list of references that I've used in preparing this particular talk, and you're welcome to take a look at those, the last page. And I also on the chat box, I've included that URL that has posting of these particular slides. So you can review those and learn more about the benefits of cannabidiol in kidney disease. Well, let's get across some terminology to make sure we're clear about different things. Acute kidney insufficiency is something that happens regularly in trauma or in insufficiency of vascular flow, where there's an interruption of blood supply, but it can also occur with toxins and with chemicals that somebody might be subjected to, as well as standard drugs. They can all cause particular problems. And this is temporary. It's relieved in a matter of days, just a few, and it doesn't require any major interaction. Now, chronic kidney disease, chronic kidney failure, is commonly termed as CKD. And this is a problem that is rather pervasive within our population. But this represents a staging of disease going from levels of kidney stage 1 is actually normal. Stage 2 is the start of kidney disease, 3, 4, and 5, and finishing up at end-stage renal disease, where there needs to be a transplant or there needs to be dialysis going on. And then finally, of course, is transplant patients that will get a kidney. That is the largest group of transplants that occur throughout the world are kidney transplants, because it's very receptive towards replacement by another human kidney. And so that's a very successful therapy with very high rates of success. Well, what's the burden of disease? We're really talking about the number of people with CKD, and I'll use that as a mid-category of people with relatively serious conditions. It represents 14% of the population of the United States. That's a huge number, about 10% of the entire world. So a lot of people are having difficulty with their kidneys and having problems. And the causes are various, and I'll go over those in the next slide. The cost to the United States alone is about $50 billion. And the number of patients who are on dialysis is in the range of 500,000. And the costs for dialysis are just horrendous in terms of on a yearly basis. Some patients are paying on the order of $1 million for dialysis going through their insurance company, whereas Medicare, as it's paid for by the government, is in the range of $50,000 per year. Quite a discrepancy, but a great deal of suffering and pain as a result of dialysis. And the other thing is that patients with dialysis have a 20% mortality rate every year. So a huge death rate that's associated with that. And furthermore, then those patients who have dialysis, most of them would prefer to get over to a transplant, because that pretty well normalizes people's lives. And there's about 200,000 that are living with a transplanted kidney in the country right now. And then finally, we look at diabetes, because I'm not going to talk about the prevalence, but the prevalence is about the same percentage, about 12 to 14% from what I've looked at in some statistics. So a huge population. And the number of people who are having chronic kidney disease are concentrated in the map that I show at the right of the slide. So it's a huge number, and it's really concentrated more so in the south than in other areas. But this particular group and this particular area is really significant in a cost to our country in both work as well as financial. So the different causes of kidney disease are quite varied. I mean, leading the list are hypertension and diabetes, amounting for probably 70% of the kidney failure that's out there. There's autoimmune diseases as well, and then drugs and toxins come into it. Things that we haven't realized as being toxic. Even some things like non-steroidal anti-inflammatories can be toxic to the kidney and cause damage. But more often we're dealing with things like Cytoxin and chemotherapy or other types of substances. There's also accidents that occur that cause injury to the vasculature or to the kidneys directly and causes quite a bit of damage in that area. Even things like statin drugs have been known to cause rhabdomyolysis, which is a breakdown of the muscle that leads to acute and many times chronic renal failure. And finally, there are genetic diseases where the kidney is malfunctioning as a result of accumulation of different proteins and cystic formation that incapacitates it in one way or another. Now, the immune pathway, I'm going to talk about the common mechanisms that are involved in the disease. So the immune pathway in kidney disease looks at T cells and B cells. They're macrophages that produce a lot of the cytokines and inflammatory substances. And I want to talk a little bit about the mesangial cell. This is a cell type that is in the glomerulus of the kidney nephron. And the nephron is a basic structure of the kidney that provides the filtering and the reabsorption of substances that we need in the body, as well as getting rid of the poisons that are there. Now, through the immune pathway, we're looking at some sort of injury. There's inflammation to the kidney tissue, and particularly the mesangial cells. There's a recruitment of other inflammatory cells to the area, and then further inflammation, and eventually fibrosis or disruptions in the membranes that lead to leakage in the kidney, in the glomerulus, and all of this is perpetrated by the mesangial cell that produces a lot of the inflammatory substances in the kidney. It has macrophage properties, whereas the general macrophage comes in and migrates, goes through the cell basement membranes and migrates into the tissue. The mesangial cells are already there, and they're producing inflammatory substances in reaction to injuries and damage. So the main processes is for the immunologic and the autoimmune types of diseases for injury to the kidney here. The diabetes pathway is a little bit different, but it's the same principle in that there is hyperglycemia, and that produces advanced glycosylation end products. And these, as a result of proteins combining with high glucose levels into large molecules that can't filter through the kidney very well, they're also toxic to cells when they get uptaken by endothelial cells, the lining of blood vessel cells, as well as macrophages and the mesangial cells we talked about in the glomerulus. Now, as these build up and these products build up, they produce a blockage in the filtering system or inflammation within the cells, and that leads to vascular injury as well as glomerular injury. So what happens in diabetes is you're seeing problems in vascular tissue as well as the kidney, and there is also a very high rate of cardiovascular disease. So atherosclerosis follows with this particular pathway in the development of complications for diabetes, and the same thing happens in kidney disease. It's not atherosclerosis, but it is stiffening and damage to the filtration methods and mechanisms that are in the kidney that lead to compromise of the function and its inability to filter out toxic substances as well as reabsorb the proper substances. So as a result of that, as the toxins build up within the system, they actually create more inflammation and more fibrosis, and they can accelerate the process of kidney failure in that whole environment. A little bit more on the diabetes pathway. The glomerulus is the mechanism that is the filter for the blood. Its basic setup is that it's got a vascular cluster, and then it's surrounded by a capsule, and around the vasculature, the substances, the toxins are pushed out of the body, and the waste products are pushed out, and they go down the urethra to be discharged through the bladder and the kidney, and through the bladder and the ureter for elimination. Now, the capillaries are very small vessels that are there that are very vulnerable to some of these vascular injuries that are occurring with the inflammatory substances and the AGE as well. The mesangial cells in the matrix are in between the capillaries and the ducts that provide the filtration for the ureter. And with inflammation, especially with diabetes, these build up with fibrosis and collagen, and they get blocked in their ability to provide filtering. In addition, there are some quite remarkable things that go on with these particular cells with regard to glucose regulation. You know, in most parts of the body, like within the muscle tissue, the body reacts to high levels of glucose by developing insulin resistance. And so it prevents high levels of glucose from entering the cell. That cannot be so for these cells that are within the kidney. They have no ability to regulate the amount of glucose. It's totally dependent on the levels of glucose that are in the blood and that transfer in to the cells. So they can't regulate it, and when they get large amounts of the glucose, it has to be handled, and it's handled, it can be handled as a toxic substance, developing inflammation and oxidation stress within the cell. And a lot of that promotes additional inflammation and problems and dysfunction within that particular organelle within the kidney. The endocannabinoid system is showing dysfunction in all of these diseases. We're seeing it very commonly for diabetes, for obesity, and with the kidney diseases. And the progression of kidney disease is very much controlled, at least in part, by the endocannabinoid system. Diet, drugs, toxins, and infection all have a role in shifting the endocannabinoid system and making it functional or dysfunctional. There is being established a clinical endocannabinoid deficiency that we're seeing more and more often. We're finding more evidence of disruptions in the endocannabinoid elements that indicate disease patterns. For instance, in kidney disease, we're seeing large numbers of CB1 type of receptors increased, and that is correlated very closely with fibrosis. And it occurs a lot in inflammatory and injury situations. At the same time, cannabinoid type 2 receptors are being activated, and that is showing a benefit and protection that's going on with the kidney and preventing some of the progressions of the fibrosis and the kidney disease. In addition, a not too well recognized cannabinoid receptor that is called the transient or receptor protein vanilloid type 1. It's an inflammatory pathway, and when the kidney is inflamed and it's having problems, the number of receptors in this pathway are increased dramatically. So what does CBD do in these situations and on the endocannabinoid system? Just on the endocannabinoid system, I'm focused on that right now. The CBD blocks the CB1 type of receptor, that one that's activated in kidney disease. And it blocks the TRPV receptor as well, blocking that, reducing the inflammatory combination and exacerbation that occurs. As well, the cannabidiol is working as a CB2 receptor agonist. It's actually stimulating the CB2 receptor in order to activate, providing additional protection for the kidney. And then another area is that CBD is helping to regulate the endocannabinoid system by blocking the degradation pathway for itself, CBD, and the other endocannabinoids that are within the body produces. And so this rebalances the endocannabinoid system and restoring homeostasis and maximizing the benefit and the recovery for the endocannabinoid system as well as the general health for the individual. In the immune area, cannabidiol is modulating the immune system. It reduces the number of macrophage and the number of inflammatory cells in any area that is showing inflammation. It increases the number of inflammatory types of cytokines that are being released by the macrophage that are causing a great deal of the inflammation. The things like TNF-alpha, the interleukin type 1, type 6, type 18. These are all associated with significant inflammation and significant disease. But at the same time, this is how smart this molecule is, it's able to increase the anti-inflammatory cytokines, the interleukins 4 and the interleukins 10s that calm down the inflammation in an area, and they signal other cells to disperse, and especially immune cells that are not involved with protecting against infection or invasion of any kind. In addition, the cannabidiol is decreasing the vascular changes, the vascular contractions that typically occur, the fibrosis and the proliferation of whether they're macrophages or fibrocytes that develop that additional collagen that lays down layers and interferes with the body function. With respect to general types of injury, cannabidiol is protecting in so many different areas. Like with regard to toxins, cannabidiol is protecting against cytoxin, which is one of the most toxic of the chemotherapy agents for cancer therapy. And cytoxin has been shown to be the damage. Much of it has been prevented by using cannabidiol in the particular therapy. Heavy doses were used, generally damaging 3/4 of the kidney, but CBD was able to protect against most of that damage that occurred. It also protects against ischemic injury. So in experiments and preclinical studies where kidneys were, the blood supply was blocked off or the arteries were tied off for a period of time, perhaps 10, 20, or 30 minutes, and then the recovery phase came in, then cannabidiol on board protected those kidneys against major damage in those glomerular cells and throughout the kidney. The same thing has occurred with ischemic injuries to the brain, just like having a stroke. And those results have been improved, have improved outcomes when cannabidiol is used typically 1 hour after a stroke, but as late as 6 hours after a stroke. It's been protective in preventing the severe damages that usually occur as a result, really, of the reperfusion and the inflammatory response that generally occurs. Now, cannabidiol is also protecting against the it's an anti-proliferative. And so a lot of these cells, and the fibrotic cells and the mesangial cells, they produce quite a bit more cells, and they are making more blood vessels. Cannabidiol calms that down. It normalizes the situation, so there's not the inflammation and then not the reactivity that leads to fibrosis and interference with filtration, particularly within the kidney. Cannabidiol has been shown to be an anti-immune substance, effective on the heart and on the intestines. Very effective for those particular areas. It's protected the heart in many of the autoimmune types of diseases and inflammatory diseases that are there. And cannabidiol has been, particularly on a cellular level, effective for oxidative stress. Those reactive oxygen species that the cells produce in reaction to injury or trauma or substances. Cannabidiol is able to squelch those, get those under control, and reduce the inflammatory response. It's also important for and effective for vascular stability. It doesn't reduce blood pressure on its own unless there is hypertension. So high blood pressure, we see decreases in the blood pressure, certainly not any increases in blood pressure. In addition, we're seeing cannabidiol effects on the heart are not to increase the heart rate, but it does increase the ability of the heart to contract. It gets more efficient and better functioning. And that's very helpful in kidney disease because heart disease is very common and a major part of the demise for patients with chronic kidney disease. In addition, it improves kidney blood flow. And we've gone over quite a bit already, but cannabidiol comes from cannabis. There's two types that we think of in terms of the types of cannabis, marijuana and hemp. And CBD is coming from hemp, improves health overall. And there's no psychoactive effects. It's safe, it's legal, and it's effective. It restores the endocannabinoid system, different from any other substance that is out there. How would you use cannabidiol in kidney disease? I want to focus on using a pretty standard dose, 15 milligrams twice a day. That is a great starting point for everybody. And then adjust the dose to meet the needs and the symptoms of that individual patient. Now, there's different forms to take it in, and they're all very effective. And I don't have a preference for any one or the other. The duration of action is anywhere from 6 to 12 hours, so you can get a twice-a-day dosage is effective in most people. And I think it would provide the protection needed for preventing kidney disease. A target dose for kidney disease of any seriousness, where we're talking about compromised kidney functions, should be in the range of about 60 milligrams, at least in the acute and finding out the phases and finding out how they respond to it. But perhaps it can be reduced to 30 milligrams on a continuing maintenance basis to prevent the disease from progressing in all types of kidney disease. What types of diseases can we use it for? Well, for all of the diseases that we see, but particularly for diabetes and heart disease. There's a high prevalence of kidney disease in both of these conditions. So cannabidiol could be extremely protective against the complications that typically occur. It's also effective in autoimmune conditions and hypertension and preventing the damage to the kidney, as well as modifying the risk factors that are involved with these particular diseases, such as atherosclerosis. And of course, the primary focus is on kidney diseases, but there's so many in such a variety. I haven't found that any particular disease that it could not be effective for. So let me recap and go over some of these things. There's a huge burden of disease with respect to kidney problems. The endocannabinoid dysfunction is very common, and the CBD affects and modulates, addresses all of these pathways that are involved with this disease. It's supported by numerous preclinical studies and plenty of practice experience by many users, but we don't have human studies on kidney disease at this time. There are no significant adverse effects, and there's no toxicity and a rare drug interaction that occurs. The dosing is really quite modest with fast results in terms of the response for patients and the way that they feel and their performance. I think that's always a good way to measure, to see if CBD is affecting people by the side benefits that occur. And there are a host of side benefits that are occurring with cannabidiol that you can watch, and you can see the transformation of patients and find the right dose for that individual. Thanks for being with me today to share this information, and I hope you're excited as I am for the potential for cannabidiol to help enormous numbers of people, protect them against the ravages of kidney disease and many other conditions. I've listed off a number of references here on this slide, including a reference folder that I've prepared for you. And I look forward to talking to you again about another very important topic in cannabidiol science. Thank you very much.